Two more people have died in Victoria as the state has recorded 317 new cases of coronavirus, the worst daily figure since the pandemic began. Reporter Elias Clure has more from Melbourne.
317, that's a record since this all began. Over 280 are still under investigation. Now, there's 160 separate outbreaks, the focus still of health authorities in the northwestern corridor of Melbourne. Now, despite there being record figures today, the Chief Health Officer, Professor Brett Sutton, believes we might not have seen peak figures, but we need to take into consideration the incubation period of the virus and the turnaround time for the testing. So effectively, these positive tests date back to when the lockdown restriction period started. So he hopes to see a plateauing of figures maybe within the next couple of days. Now, 29,000 tests were conducted over the last 24 hours. The Premier, Daniel Andrews, says that's a record, and today he urged people to get tested.
You can't contain this if you don't know where it is, and the most important thing for people to do, apart from, of course, following the rules, using common sense and good judgment, is to come forward and get tested if you've got even the most moderate, the mildest of symptoms. That really does give us the data, the intelligence, the clear information that our coronavirus detectives can then use to contain further outbreaks and to bring some stability to these numbers.
So, Elias, of the more than 2,000 active cases of coronavirus in Victoria, 109 patients are in hospital. 29 of them are receiving intensive care for the virus. What's the extent of the impact on hospital staff and facilities?
Yeah, well, Karina, I'm at the Royal Melbourne Hospital here in Royal Park, where they've set up actually a special ward specifically to cater for the elderly. And unfortunately, we've seen quite a few outbreaks in Melbourne hospitals. We've seen outbreaks at the Alfred, one at Royal Children's Hospital, unfortunately. Now, as a result of this, the government has done a number of things to beef up the health system. Today, it announced it would also pause Category 3 elective surgeries and has spent $30 million on recommissioning the Peter MacCallum Centre to create 34 beds. But it does say it's got capacity to cater for about 4,000 people in intensive care and 2,100 people who are on ventilators. As you mentioned, 109 people in hospital, but many of them also younger people. Now, Jenny Mikakos says the government's doing everything it can to ensure that the health system is as strong as possible. Let's have a listen to the Health Minister.
The health sector has not stopped preparing since this pandemic started in January. We have created more ICU capacity, more beds in our hospital system, and we have undertaken extensive training of our staff. So our health system, our hospitals are well prepared to respond to this second wave of coronavirus cases.
Several new virus cases have been diagnosed in Sydney southwest, taking the cluster which began at the Crossroads Hotel to around 40. At least 4 have been linked to the hotel outbreak, including one person who contracted the virus when they attended the Hurricanes Grill in Brighton Le Sands with a known case. Reporter Cecilia Connell joins me now from Sydney. Cecilia, what's the latest breakdown in numbers?
Karina, there has been a slight change in the way that numbers are reported. So in the 24 hours to 8 p.m. last night, there were 10 new recorded cases. Now, of these, 4 were recorded in hotel quarantine. 3 have been linked to the Crossroads Hotel cluster at Casula in southwest Sydney. But perhaps most concerningly, another 3 cases remain unidentified. 3 unidentified locally acquired cases that are under investigation. New South Wales Chief Health Officer Dr. Kerry Chant said that epidemiologists are retracing possible transmission lines to try and identify how these cases came to be. Here's a little of what she had to say on that matter.
Obviously, we are concerned when we find cases that can't be linked back, because it does indicate that we've missed a chain. So we will be re-interviewing cases and trying to ascertain any contact points and updating the community about additional actions. But it does highlight the fact that at this critical point, we do need people to continue to practice social distancing, make sure you isolate yourself if you have the most minimum of symptoms and get a test.
New South Wales Chief Health Officer Dr Kerry Chant there. And as I said, Karina, there has been a slight change in the way numbers are reported. So 10 new cases were recorded to 8 p.m. last night, but since that time, another 5 cases have been identified. 4 of these are linked to the Crossroads Hotel cluster, but a 5th case has been linked to a person who travelled from Melbourne to Ballina on a Jetstar flight on the 12th of July. Now, that person was screened at the airport and was wearing a mask and had been in self-isolation. But as I said, the main concern for health authorities at the moment are those 3 unidentified locally acquired cases.
And there have been more venues that have been added to the list that have been affected because of the Crossroads Hotel cluster.
That's right, Karina, and perhaps not unsurprisingly, as you would expect, as the number of cases linked to the cluster continues to grow. So we have had another case linked to Hurricanes Grill at Brighton-Lee Sands, a person who was in attendance at that venue with a person who had already contracted the virus and had been and was in that cluster of the Crossroads Hotel. Also a restaurant in Wollongong, a pizza place at Belfield, and also, as we've heard, the Magpies Sports Club at Croydon Park. So, as I said, Karina, not surprising that the number of venues is growing. Those venues have undergone an extensive clean, and the full list can be seen on the New South Wales Health website.
And what is the latest advice from health authorities around gatherings?
Now, Dr Kerry Chant really stressed that it's important to maintain good hygiene and social distancing, and where adequate social distancing can't be maintained, to wear a mask. What she did stress today was that people, I guess, shouldn't take their close social network, underestimate their close social network. These people can still be infectious and shouldn't be underestimated or considered some sort of safe zone. All precautions must be taken.
Cecilia Connell, thank you so much.